Diabetes is a complicated condition. It's an everyday disease. If you're caring for patients in the home without a very clear, structured environment based on clear guidelines, patients are at risk for hypoglycemia, DKA, diabetic ketoacidosis, and other acute complications. So as a clinician, those are the things that I fear the most for my patients, having something bad happen at home when there's not appropriate support and care set up for those patients. Well, I think in a number of ways, having a standardized disease-specific program could benefit a home health or hospice agency. First of all, it provides the evidence-based guidelines to provide appropriate care for people living with diabetes. Second, it provides a structure for ongoing evaluation of the performance of that program and hopefully improvement. And ultimately, that will lead to better care for the patients. And we think of better care as improved long-term outcomes for some of those patients. And across the board, we really care about short-term outcomes as well, and reducing the risk of complications.
Why would you then be more likely to refer a patient of yours to a home health or hospice provider who'd gone through this process of certification?
Having the certification itself to show clinicians like myself that the agency is dedicated to that care is priceless, because as someone who cares for patients, I want to make sure that my patients go to an agency that knows what they're doing. If we can turn to something like a disease-specific certification program like this to know that this agency has gone through this process and continues to actively improve is meaningful. And that alone can make me decide between one agency referring to another one that doesn't distinguish itself in that way. What I thought was most important was to lead with evidence, making sure that the program-specific guidelines were based in the evidence that we have out there in the literature, the newest, most recent guidelines that are available. I believe that those guidelines are what will best lead to improved patient outcomes. We are fortunate that we have new medications, new technologies to help care for our patients, but it's hard to keep up. With those new treatments and those new technologies come issues, come concerns, and potential pitfalls. So to have updated guidelines that really reflect the newest and greatest technologies and treatments and approaches for people with diabetes is essential.
Is that one of the reasons you feel like an annual review of these standards is a best practice?
I feel very strongly about that, in particular in diabetes, because things change quickly. It's a rapidly evolving field. Without an annual review, an update of the guidance, and update of the guidelines, things will be missed. Things are happening too fast.